I saw one patient that came to the hospital. His legs were deformed. It turns out that he had fracture many years ago. And of course, you know where he went. He went to the traditionalists and they did their thing. But after their thing, the guy's leg was deformed. The guy's leg was crooked, what Igbo people will call bagoro bagoro. Now that bagoro bagoro leg was because the traditionalists, of course, did his thing and the leg became deformed, S-shaped. So this guy had fracture that was quite severe. And instead of going to the hospital, he went to traditionalist. That is just one case out of many cases. And that is a common thing, common sight in the hospital when people come for physiotherapy. Many of them come after years of going to traditionalists and wasting their time. Gentlemen and ladies, this is why I'm here. I've come and tell you. I'm an educator. It's my passion to educate the public. I've come and tell you. There are many people that come down with deformities because they went to the traditionalist first. All right. Medical practice is complete. I'm not saying that medical practice has all the answers. No, that's not what I'm saying. But the truth is, Nigerians have not benefited from half or quarter of what medical practice has to offer. I'm telling you, medical practice, people, for instance, in the US, in the UK, there are diseases, conditions that do not kill people again. People don't die from those conditions again. How can people still be dying of childbirth? How can people still be dying of malaria? How can people still be dying of there are conditions that don't kill people again in the West simply because of medical practice. So medical practice has gone so advanced, we've not fully harnessed it, we've not benefited from it. So when someone has that kind of fracture, you want to come to the doctor, go to the orthopedic doctor. You will recover clean, the way your leg will heal to be well aligned. If you don't want your leg to be bagoro bagoro, someone will now say, okay, what of those whose legs were not bagoro bagoro after they went to the traditionalists? Well, the truth is that the truth is that there are different kinds of fracture. There are some fractures that even if you didn't go to the traditionalist, if you just take a bandage and wrap around your leg and keep the leg one place, maybe use a stick and hold the leg in place and wrap it. I'm not saying you should do that, but I'm just telling you, if you do that and keep the leg one place for 2 months without matching it on the ground, it will heal perfectly fine. So you didn't need to go to the traditionalist for that to happen. But then you get a fracture but then there's a high risk of possible infections. There are many things that could have happened, which is why you go to the doctor. There are other fractures that if you do this thing I just said now, terrible things are going to happen. For example, there may be fragments, bony fragments within the joint, within the region, within the bone, whatever the fracture happened. So you want those fragments to be practically removed or rearranged in the right form or shape, right? And so it's real. Many people are coming down with deformities, plenty deformities because of traditional medicine. So if you can afford modern medicine, please do well to go for modern medicine.